Hey friends, thanks for joining us today on our journey to becoming another super dental assistant. Don't forget to like and subscribe and pay attention to some of our upcoming videos. Today we're going to be showing you how to set up for a Class 2 restoration. This Class 2 means that there is an occlusal surface as well as one proximal surface in the restoration. Let's get started. We're going to start with the armamentarium on the assistant side. These are all the gadgets and tools that you'll need to have a successful restoration. Starting off, we have topical anesthetic. As a level 2 DA in Ontario, you can use this product and apply it to your patient. This is used prior to injecting the local anesthetic. This product here that we use is Hurricane. It's a 20% benzocaine product. Next, you're going to be grabbing your local anesthetic, your needle and syringe. Today, we are going to be using a non-aspirating syringe. That means that it doesn't have a harpoon end where the carpule goes. It's a flat end. Our choice of local anesthetic today is Septinest. We use Septinest sometimes when the doctor wants a quick onset of anesthesia, and sometimes if a patient is resistant to typical lidocaine as noted in their chart. Since we're going to be doing an infiltration for the 4,5-DO that our doctor is going to be doing a restoration on, we'll be using a short needle. The first bit of material is our acid etch. This here is a 37% phosphoric acid. The dentist uses this to remove the smear layer from the dentin in the cavity prep. Next, we have our bond. This is used on the cavity prep to help our composite resin material adhere to the tooth surface. This gives us not only mechanical retention, but chemical retention too. Always important to have in addition to your bond is your applicator brush and a well to put your bond into and have ready for application into the cavity prep. This here is our G5 desensitizer. Not every dentist will use this. Some dentists swear by it. This is simply just a varnish or desensitizing layer that's used for the cavity prep. This prevents any mechanical or physical irritation. This here is our sectional matrix ring. We use the Garrison brand at our office. It is used in conjunction with a plastic wedge and a sectional matrix, which goes in the proximal surface of the tooth. This tool is used to recreate the proximal surface using the composite resin. It's important to use the correct size when picking your sectional. In conjunction with the sectional matrix and ring, we have our sectional matrix ring forceps. These are used to help you place the sectional matrix ring. This here is our composite resin gun. It's used in conjunction with our composite resin cartridge, which helps our dentist to safely place the composite resin in the cavity prep. It's always good to have a second composite resin cartridge handy just in case you accidentally run out during the procedure. A bite rest. Sometimes a bite rest is needed if the patient is not comfortable holding their mouth open the whole time. This can just make their life a little bit easier. A few other things you'll need on your setup: articulating paper as seen in the top right corner. We also have gauze and cotton rolls, as well as floss. These are some major components to a successful restoration. Next up, we have our curing light. These come in all shapes and sizes. It's always good to test that your curing light works prior to your restoration. The button can be toggled to change the amount of time that the curing light is shining for. Next, we'll talk about setting up the dental chair. First things first, barriers. Make sure that you have barriers on all of the appropriate equipment, such as your control panel for the dental chair, your headrest. A few things that I didn't cover quite yet are the individual air water syringes. Will typically need barriers, the control panel on both the dental assistant and the operator side. Always make sure that you have your high volume evacuator tip, your saliva ejector, as well as your air water syringe tip. Moving on to the operator side, a few things that are important to have: your high-speed handpiece, for example, your slow-speed handpiece as well. It's important to have a 1-to-1 gear ratio. This is required for restorations. Typically, hygiene will use the 4-to-1 ratio. Make sure that they're not mixed up. It's always good to check that your high-speed and slow-speed motors are both in the correct position on the operator's side. Sometimes they won't work properly if they're sitting in the wrong housing. Next, we'll go over the different burrs that are needed for a typical restoration. This here is a latch grip round number 4 burr. This is used in our slow speed. You'll see as I show here that there is the latch grip side. This is specifically for the slow speed. Next, we have our FG number 5 round burr. This is a high speed burr, typically used for entering the cavity prep or using it for the initial prep and removing some of the carious dentin. Next up, we have our flat end cylinder diamond burr. This is very similar to your FG357 or your straight Fisher burr. Our office just likes to use the diamonds. As you can see here, we have the round end cone diamond burr, another high-speed burr. Next, we have our football-shaped diamond burrs. These are often used on the occlusal surfaces when you're finishing the restoration. Once the composite resin has been placed, there are different courses. So we have medium and fine and heavy in terms of grit. This here is the mandrel. This is typically used in conjunction with sanding discs, typical for finishing composite resin restorations. And last, we will show you the silicone inverted cone polishing burr. This is typically used again at the end for a final polishing of the restoration. In our restoration cassettes, we typically have quite a few different handpieces. For starters, you'll always have cotton pliers. This is for doing things like handing things and items and materials to the dentist, in and out of the oral cavity. Next, we have our pigtail explorer. There are several types of explorers. Our office and our dentist just prefer the pigtail explorer for restorations. A ball burnisher, typically not used for composite restorations, but some dentists do like it for composite in some cases. Up next, we have our periodontal probe. This could be for anything from measuring pocket depths to even helping place composite resin. A mouth mirror will always be used in every restoration, pretty much every procedure at the dental office, for indirect vision as well as light reflection. A PFI or plastic filling instrument is used for placing the composite resin in the cavity prep. This also helps them shape the cavity prep in different increments. We have our spoon excavator. This is used typically after using the high speed and slow speed to remove stenton as we get closer to the pulp. And lastly, we have our sickle scaler. This is used to remove any excess flash from the restoration. Once we've placed and cured the composite resin, there tends to be sometimes some flash or some excess composite around the edges. Last, we have our articulating paper forceps. These are used to see any high spots on the restoration. That's it for today, guys. Thanks for watching. We look forward to seeing you in our following videos.